Did you know that some of the earliest signs of diabetes are subtle, and often go unnoticed until the condition has advanced? Diabetes, particularly type 2, affects millions worldwide, but its early stages can be silent and tricky to detect. Today, we'll be diving into the 15 strange signs of diabetes, helping you recognize potential red flags and understand how early intervention can prevent long-term complications. If you or someone you know is experiencing any of these symptoms, it's crucial to take action now. Let's explore these warning signs, why they happen, and what you can do about them. Before we get into the signs, let's first understand what high blood sugar really means. According to the American Diabetes Association, high blood sugar, also known as hyperglycemia, occurs when your body doesn't produce enough insulin or doesn't use it properly. Insulin is the hormone responsible for allowing glucose to enter cells to be used for energy. When insulin isn't functioning properly, glucose accumulates in the blood, leading to various health issues. There are three main ways to diagnose diabetes. Fasting glucose test. Normal levels are below 99 mg/dl. Prediabetes is marked by levels between 100-125 mg/dl, and diabetes is diagnosed at levels above 126 mg/dl. HbA1c test. This test shows the average blood sugar levels over the past 2 to 3 months. A result of 5.6% or lower is normal. 5.7% to 6.4% indicates prediabetes, and 6.5% or higher confirms diabetes. Oral glucose tolerance test. After fasting and drinking a glucose solution, your blood sugar levels are tested 2 hours later. A level of 200 mg/dl or more indicates diabetes. It's essential to be aware of these tests because prediabetes can still cause damage, especially to your nerves, heart, and kidneys. This brings us to our first sign of diabetes. 1. Tingling and numbness in the limbs. Diabetic neuropathy. Diabetic neuropathy, which refers to nerve damage caused by high blood sugar, is one of the earliest signs of diabetes. You might notice a tingling or burning sensation in your legs, especially in the evening. This happens because excess sugar in the blood can damage the nerves, making it hard for them to communicate properly. Even slight elevations in blood sugar can lead to these sensations. Example: Mr. Allen, 62, from Florida, noticed a tingling sensation in his feet for months, but he didn't think much of it. It wasn't until his doctor conducted a blood test that he discovered he had prediabetes. After making dietary changes and managing his blood sugar, the symptoms significantly improved. 2. Acanthosis nigricans. Dark, velvety patches of skin. Acanthosis nigricans is a skin condition that appears as dark, velvety patches, often found in body folds like the neck, armpits, or groin. This condition signals insulin resistance, meaning your body is producing insulin, but it can't process sugar properly. As insulin levels rise in the blood, this skin condition can develop. Example: Mrs. Jenny, 57, from Texas, noticed dark patches forming on her neck. After consulting her doctor, she found out that it was a sign of insulin resistance. With a diet focused on whole foods and exercise, her insulin sensitivity improved over time, and the skin condition began to fade. 3. Slow digestion and feeling full too quickly. High blood sugar can impact your gut motility, causing slower digestion. You may feel full after eating only a small amount of food, or have trouble digesting meals. This feeling of fullness without consuming much food is often overlooked, but it could be a sign of elevated blood sugar. Example: Mr. Paul, 69, had been eating smaller meals but always felt overly full. After some testing, his doctor found his blood sugar levels were consistently high. Once he made dietary changes and focused on managing his blood sugar, his digestive symptoms improved. 4. Reactive hypoglycemia, low blood sugar after eating high-carb meals. Reactive hypoglycemia occurs when your body overproduces insulin in response to a meal rich in carbohydrates. This excessive insulin can cause your blood sugar to dip too low, leading to symptoms like shakiness, cold sweats, and dizziness. If you notice these symptoms frequently after carb-heavy meals, it could be an early warning sign of diabetes. 5. Excessive urination and sweet-smelling urine. When blood sugar levels rise above 180 mg/dl, the kidneys start to remove excess glucose through urine. This leads to frequent urination and, often, sweet-smelling urine. The sugar in the urine can even attract ants, a clear and unusual sign. Example: Mrs. Kate, 75, from Ohio, found herself visiting the bathroom more often than usual, and noticed ants around her toilet. After checking her blood sugar, she found that it was well above normal. Since then, she's worked closely with her doctor to manage her blood sugar levels, and the symptoms have diminished. 6. Blurred vision. When blood sugar levels are high, glucose molecules can draw water into your eye lens, causing blurry vision. This change is often temporary and may improve once blood sugar levels are controlled. 7. Wound healing issues. If wounds or cuts take longer to heal than usual, it could be a sign of diabetes. High blood sugar interferes with the body's ability to heal, making it harder for the skin and tissues to recover from injury. Example: John, 66, from New Jersey, had a minor cut on his finger that took weeks to heal. After undergoing testing, it was discovered that his blood sugar was elevated, leading to slow wound healing. With improved blood sugar management, his healing process returned to normal. 8. Unexplained weight loss. Diabetes, particularly type 1, can lead to unexplained weight loss. When the body is unable to properly process glucose for energy, it turns to fat and muscle for fuel, leading to unintended weight loss. 9. Extreme fatigue. Excessive tiredness can be another sign of diabetes. When the body can't use glucose effectively, you may feel constantly drained, no matter how much rest you get. This fatigue is often more intense than the usual tiredness experienced due to aging. Example: At 70, Mr. Steve noticed that he was always tired, even after a full night's sleep. After getting his blood sugar levels tested, it was revealed that he had prediabetes. His fatigue decreased once he began managing his blood sugar through diet and lifestyle changes. 10. Infections, especially oral and skin infections. High blood sugar weakens the immune system, making it easier for infections to take hold. Gum infections, or periodontitis, are particularly common among those with diabetes, and they can increase the risk of heart disease. If you notice frequent or severe infections, particularly in the mouth, it's important to get checked for diabetes. The signs of diabetes can be subtle, and many of them overlap with other health conditions. However, recognizing these early warning signs can help you seek the right treatment before complications set in. Regular blood sugar testing, along with lifestyle changes like a balanced diet, regular exercise, and stress management, can help you maintain healthy blood sugar levels and prevent diabetes-related complications. The key takeaway here is that early detection is critical. If you're noticing any of these unusual signs, don't ignore them. Instead, get tested, make necessary lifestyle changes, and consult with your healthcare provider to keep your health in check. Remember, diabetes is manageable, especially when caught early. Let's take control of our health and prevent diabetes from affecting our lives. Stay healthy, and take proactive steps toward better well-being. Disclaimer: the information in this video is for educational purposes only and is not intended to replace professional medical advice, diagnosis, or treatment. All images, including those of doctors, are AI-generated and for illustrative purposes only. Please consult with a healthcare professional before making any health-related decisions.